Hello, everybody, and welcome back to the Patient First Podcast. I'm your host, Dr. Bryan Laskin. And as always, I'm excited that you're here. Today, we have a phenomenal guest. Aimee Vail has been in the dental industry for over 25 years, graduated from dental hygiene program at the University of New Haven in 2004. Currently, she is the Special Markets Manager for North America at Centrix Incorporated, and she teaches across the country dental offices about the importance of fluoride and caries prevention. Aimee, thanks so much for being on the pod.
Thanks for having me. I'm excited to be here too.
Yeah. And I think we were talking at a show and you were telling me all about a new development at Centrix, which is a cool company. They're creating some cool products. And one of the latest ones is your silver diamine fluoride, which I think we were talking just a little bit before the podcast about, I would say, the lack of utilization or maybe the opportunity to start incorporating SDF into offices more. So could you talk a little bit about SDF therapy and where you see it fits into practices?
Oh, sure. Yeah. So Centrix launched our SilverSense SDF on January. And actually, I just want to say something. We just won the Dental Product Shopper Award as well, because really this is, and they call it the breakthrough therapy. Typically, silver diamine fluoride is found in your pediatric offices and your public health spaces. What we're trying to do is get the message out to those practices, say your general practices, right? More of an adult population. We can get our adults out of pain with SDF and not have them wait for 2 weeks until the restoration can be placed or they can be seen. And what we're doing is we created a CE course for SDF. I teach, as you said, fluoride and SDF across the country now to whoever will listen to me. And I know of a practice up in Wisconsin too. They no longer use needles or drills, they just use pain free dentistry and SDF. It's such a great product because you can place it on the carious lesion, it arrests the decay, and then you can control their caries, right? You can wait until their oral health can be improved and then we can restore. There's just so many uses for it for public health, pediatric, and in the general practices. I also recently last month came back from a public health mission where I was able to use our silver sense in practice. And it was actually one of the first times that I used the SDF. And a little boy came, and it was on the Indian reservation up there in Montana. And a little boy came to me, and my tooth really hurts, right? And as a healthcare provider, we were doing this because we care. I'm assuming most of us. And he just came in my chair, and I was able to get the silver diamine fluoride on his number B and arrest that decay and get that baby out of pain. So it's just I love the product. I love its uses. I wish actually that my friend was over my house. I put in a temporary filling for her yesterday. So she broke her tooth.
Mm.
And she went to the dentist down the street and I was like, "Oh gosh, I hope they use SDF because she's in pain." And it's not it wasn't going into the pulp. They let her go. They told her we're going to order a crown, but she's still in pain. Like we could have just put the SDF on and waited for that restoration, she'd be out of pain. It just, it, for, I believe really we need to use it more widely in the general practices. And because there's so many uses out of it. And then the other thing too is that I want to address the concern that the teeth turn black. Right. We all know this, that it's like, okay, that's silver. First of all, silver is going to kill all those carious germs, right? All those germs. And then yes, it is going to turn the lesion black. It's only going to be turning the affected enamel and dentin black. And we know that decay can be dark anyway. But seeing that I've been in dentistry for, a long time, uh, most of the dentists that come out of dental school can really do great cosmetic dentistry and do that. So then it's their role after they put the SCF on. Yes, the lesion's going to turn black, but you are so trained and capable to make sure that lesion doesn't show, and you can put a composite on there. More we want the glass ionomer on there because of the recharge and the fluoride release effect into there, but you can put a composite. over it. You just want to wait a couple of weeks because when you cure it, as I've seen in practice, whew, that makes it really dark. But again, you are completely trained to make sure that those fillings look like you never even put SDF on there. So it's just a really universal tool that everybody should have in their office for patients.
So you're saying that there's obviously a lot of implications or there places where you can leverage SDF. I've always thought about it from like a caries arresting perspective
Mhm.
in people who have rampant decay, not as much as for desensitization. I can't say it.
Desensitization as the FDA
Thank you.
approves
That's
it,
right.
right?
Yeah,
Oh,
exactly.
right. So that's their, primary use. They've FDA cleared. We love yes, the FDA. I was waiting for the FDF or the I'm sorry, the FDA to clear our SilverSense last year. I remember the day like it was like I was getting married. October 27th is when they approved, and I was like, "Woo!" But the FDA has cleared it for desensitizing, right? There's an off-label use for caries control, for caries prevention. We have 2 different codes for it. Right,
Right.
and we can do that. You can take the deep pits and fissures, you could take that and use it as primary prevention, and that those silver ions in there, ta you can see if I love to see the microscopic view where the silver, penetrates and you can see it into the dentinal tubules. So it's constant it's silver's antibacterial.
So you mentioned a dentist in Wisconsin, although you said up in Wisconsin, and I'm in Minnesota, so it's actually down in Wisconsin.
Oh, I don't know
But
where Wisconsin is half the time.
but and this dentist doesn't use a drill to remove the decay after
You
the
don't need to.
yeah,
You don't need to remove the decay before, place the so, I mean, if it's really a lot, get whatever food impaction is in there and maybe use a spoon excavator, but yeah, when I apply SDF, we're just gonna apply it and we're gonna scrub it in there for about a minute. It's not necessarily needed to remove all that gross stuff that's in the tooth, right?
yeah,
And yeah, so I did, and I was just I was floored. I was like, "Wow, you do not use any needles or drills, and you're using the SDF." So it's just he's a trailblazer, right?
yeah.
Definitely a disruptor, like the change agents that we are, Dr. Laskin. I'm just so impressed. But my point is that everybody has a potential to do this, right? We don't always wanna drop the drill, but if he's doing it primarily in his practice, then some integration into the general, and what I find is that it's just education. It's really just education. I'm doing silver diamine lunch and learns, and that's available for any office, completely free. We have a 1 CE credit course taught by either yours truly or one of our other wonderful team members here at Centrix, and we also have one on the fluoride too, but if he's doing it can definitely be done, and you can incorporate it, maybe even just half of it. But again, the education, people don't know about it. And then,
Mhm.
okay, so when I do present the lunch and learn and afterwards, I've had people automatically, they want a bottle. They're like, "Send me a bottle." I'm like, "Okay." So it's really once you find out, and it's pretty easy. There's not much to it, but there is. It is such a breakthrough therapy. I think the FDA called it that. I know Dr. Fricella calls it that too, the breakthrough therapy drug. But this is it. I haven't met anybody that likes a needle or a drill. Have you?
No,
No,
I'm
no,
no.
no.
Maybe people with lots of tattoos, but
Oh
that's about
yeah,
it,
yeah,
right?
maybe. I only
Yeah.
have one and I didn't really enjoy getting it.
So we incorporated SDF in my I don't know,
Yeah,
5, 6, 8 years ago. It's been a while,
yeah.
and why do you think it hasn't do you think it's just education? That's why most dental practices are jumping
Well,
on the SDF bandwagon?
let's talk about that. So, SDF coding or submitting that code to the insurance company might give $100
Sure.
reimbursement. Uh, I don't want to comment too much, but a lot of it, we are here. I always say I don't work for free,
Yeah.
but I'm always wanting to do what's right for the patient. And I'm sure people do that, but sometimes I think it is a lot about education, but then also we are running a business. There's always going to be different treatment options. I am working with a doctor And one of the things with his program is let's give the non restorative treatment options through AI and let's give the restorative treatments through AI and let's have the patient decide.
Hmm.
That's what
Oh,
we
that's
should
neat.
that's what we should be doing. We should be presenting both clinical pathways to non and let the patient decide what's best for them. And,
Well, it's not.
obviously guide them, but with our knowledge, but that's why I think it's not more mainstream.
You can also. It's not one or the other. You can use SDF in incorporating it into the
Yeah,
workflow of a more traditional
sure.
restorative practice too. So if let's say you have a sort of an average size class 2 lesion that you're going to use SDF and then restore with a composite.
Yeah.
Would you recommend waiting after doing the SDF therapy for a length of time prior to doing the restoration, or you can just go ahead and do it?
It's really going to be determined, do we need to do caries control? Do we need to make sure that their oral hygiene is a little bit better? Is the lesion arrested, right? So you typically want to do a retreatment on
Hmm.
there. But so it's can I say definitively what to do? What I would say is in some cases you can restore that same day, and I would make sure that's a glass ionomer on there to recharge and make
Mm.
sure that the fluoride release. If you want to go to a composite, you need to wait a couple of weeks because of the cure light and how it does turn. Or again, with caries control too, sometimes you got to apply the SDF and sometimes you gotta reapply it in a month or whenever the patient comes back or in 6 months. So it's very versatile. Like you said, there are so many options that you can incorporate it into the practice. But no, you could restore right away or you don't have to restore right away depending on what the patient is, what they're presenting with.
I think the vast majority of the time we would, if somebody had multiple carious lesions, use STF to kind of arrest things, and
Yeah.
then, like you're saying, once the caries is arrested, then going ahead and restoring a couple weeks later. Yeah, it's great stuff. I'm it's one of those few things that's being used from a clinical side in public health setting that's not being used in a general setting, and it really doesn't make any there's no
Thank
real
you. It
reason
doesn't
for
make
it.
any
But
it
yeah,
it doesn't make any sense because if we knew and the other thing too is I'd like to push for is, I'm always pushing, you are too, Dr. Laskin. So we're pushing for things is right, that's what we do. But
yeah,
getting it into the nurses' hands so we can keep our dental patients. I'm pretty sure that you recorded a podcast that said this particular patient was going to the hospital when it was a dental emergency. So I mean,
one third,
yeah.
1/3 of dental emergencies, right? You know,
Right.
go ahead.
Yeah.
I'm sorry I interrupted you.
No, so it's fine. So that's getting it into the general offices. I'm so busy, right? Getting it in the general offices, getting into the nurses' hands, getting it into those healthcare workers that can do it as well to help people. We don't necessarily want them in the hospitals, but imagine if it was. Imagine if they had that. They knew to how to do it. It's easy. Yeah, so that'll be the next step after I cover. We're gonna get it into 90% of the general offices. Give me about a year. No, I'm kidding. And then we'll go to the hospitals.
Yeah, yeah, I think I can just hear the dentist like getting SDF in hospital systems. Like they feeling like like patients shouldn't end up in the hospital with a dental issue. But in reality, 1/3 of dental emergencies end up in the ER because dentists will have on their voicemail, if you have a dental emergency, call 911. But then if the patient actually goes to the hospital, they're like, but this is a dental emergency. So I feel like there is, when we talk about the medical dental connection,
Mhm.
there's, this needs to happen for patients, period. I think arming the healthcare systems, the medical practices with things like SDF that can help alleviate pain without having them give a palatal injection and like the crazy stuff that goes
Right.
on right now, and giving them teledentistry tools, which is what we're trying to
Oh,
create to have it so that people can be routed from a hospital to a dentist where appropriate. But then also where the real medical dental connection has to happen is I believe in dental practices. We need to know more about the health of our patients. And in this case, even just the how to use this is not new. This is not new. Like SDF is not new. This has been around for quite a while, and it's been used
1960?
1960,
I
really?
think it was introduced in 1960 back in
Wow.
Japan. Yeah, so it's been out there for a long time. And so really 2014 we got the FDA approval, and then there was another company that did a phenomenal job of putting that product out there and doing a lot of the research too. And that's where it's less than 10 years. Oh no, it's just 10 years now. But we do know the dental industry, we move a little bit slow.
Yeah,
So
that happens
we
sometimes.
joke
Well, it's
about
funny
it,
though,
but
you would think in something like caries management that it wouldn't, because
you would think so, but still I am still finding plethora of offices that where we still need to talk about right?
Mhm.
And fluoride varnish. And I feel that 85% of the patients should be getting fluoride varnish, but sometimes it's really not the case. So we're still doing that again. So we're working on it. It's really we've got a lot of big players, a lot of disruptors in the industry that can, talk about this. So it's just going to move forward. So wherever we are at the point right now, yeah, we're a little bit slow, but we do have, like I said, some big players and that know and will educate the rest of the dental industry, and we'll see it. We'll see it. Medical dental integration just in the last 5 years has been a great buzzword where, you know, a lot of us have been talking about that for years rather than just five. But yeah, we'll get there.
Yeah, yeah, I think there's a lot going on right now that's gonna help connect dentistry to medicine and dentistry. I think it's a one of called connected dentistry over here at Tooth Apps, because I feel like that's the trend that we're moving from analog to digital to connected.
Yes,
And
I love with the connected dentistry because that's what we need. So again, another story. I was so frustrated on Tuesday, and not at anybody. It just was the situation. So we recently changed healthcare insurance providers here, and think I'm glad I have coverage. But I brought all three of my children to the dentist, and mid treatment on one of them, they didn't do the insurance verification. First of all, my first child went in and completed treatment, prophy x-rays, fluoride, and then my second child went in and I stopped treatment because there was no coverage. And I'm like, "Oh, okay, I'm already on the hook for 350 for this first child, so let's stop the second child, right?" But where now what? Now, if I had that central kind of location, everybody could put that in there and they could just pick right up. It is the continuity of care too. So I do love that. We need that. And also what you hit on too, teledentistry. I wish I had like four of me, Brian, but it is all needed. But we're moving forward with that, with teledentistry now, with these connected healthcare apps, with just AI, I just saw yesterday that the FDA approved the AI for pediatric patients. I think with one of those wonderful programs that are out there. I believe there's 3 companies that are doing that.
there's a lot, and a lot coming. The innovation going on in dentistry is impressive. What's going on right now,
Yeah.
and including and I appreciate all you're doing to educate people. And I know you provide as a service basically the education so that people can learn more about SDF
Mhm.
and what you're doing. Where can people go to sign up?
Oh, so come right on to centrixdental.com. And today I just want to make mention happy birthday to Dr. D. But right after this, we have a party in our lunchroom. He's going to be 90. We are still making dentistry easier over 50 years later and bringing in these innovations. So, again, centrixdental.com. I'm on LinkedIn. If you want to get a hold of me to learn more, I'm happy to do whatever I can to teach about the silver diamine fluoride, about caries control, about prevention, because it really is. We focus on prevention so much. It's just so much better for our patients.
Absolutely. Amy, thank you so much for being on the podcast, and thanks for all you do for dentistry.
All right. You too. I'll see you soon.
Take care.
Okay. Take care.